and welcome to Olsem Wanem. For the first time, Papua New Guinea got a medical service it never had before. The Fred Hollows Foundation, with partnership with the Divine Word University in Madang, commissioned a new eye theatre last month. The focus now is to help those who cannot afford eye treatment overseas. Edwin Fidelis with this report.
Located at the Modilon General Hospital in Madang, the new eye care treatment facility is now open to the public in Madang and the rest of Papua New Guinea. In a small but significant gathering last month, officials of the Fred Hollows Foundation, PNG branch and its affiliated institutions gathered to commission the opening of the infrastructure. It may seem small, but its existence is one that the country has never had before.
We looked at what was the need in terms of eye care and how we could perhaps help as an organisation. And then I think in 2007 there was a training agreement established creating a postgraduate diploma in eye care in partnership with the Divine Word University and partnership with the hospital. And that's been a really strong partnership that sees us here today, continuing the good work of all three parties.
This medical equipment for eye treatment was a contribution from the New Zealand-based Fred Hollows Foundation.
We are building the national health system of Papua New Guinea. We're not working in an allied or in an isolated way. And so the Fred Hollows Foundation seeks to train Papua New Guinea doctors to be ophthalmologists, that's a specialist eye doctor, and Papua New Guinea nurses to be specialist eye nurses.
The foundation operates in Madang and works closely with the Divine Word University and the Modilon General Hospital to provide training to eye health professionals.
Up to now, the focus has been more on establishing eye care services to address some of the core blinding diseases such as cataract, and we focus on human resource development.
At the opening of the facility, Father Jan Shuba, president of the Divine Word University, said Papua New Guinea should be focusing on creating basic services that is not only reliable but sustainable in long terms.
We need to align our health plans to this plan, which eye health services must be delivered to all parts of Papua New Guinea. So how we can do it? How we can operate on eyes when we have only one operating theatre in Madang right now? How you can have 7.2 million people if you have 9 doctors only?
The Divine Word University is one of the institutions that has taken lead in providing eye care specialists to meet the growing demand of eye care health in the country. At the eye care ward, I met Albert and his 10-year-old daughter. They came all the way from West New Britain province to seek this eye care service.
Step West New Britain, Kimbe. So, miti bla kami long. Kisi malibim lo pigini lo mi name lo Benita Albert. So, miti bla kami lo ni di malibim long ay blongan. Pigini lo mi em wampla pigini we. All been play inside lo fence blom blow yard blom blade na ikato last place mangi bin kam now na taiti mo lisel bunarana suti mai blongan.
His daughter was struck on the right eye with a piece of wood while playing with her friends. She may not be able to see again, but her experience is one that reminds everyone about the importance of the eye.
I'm going inside looking doctor. A doctor been checking my blood. I've been talking him. Eye blown and more right as well. Sambla one in chat lo eye blown and backside through. Bin bakarap pinis. Kasi nam tiplo lo stop lo. Wait can now blown. Go back and long kimbe now.
Here you also get a sense of the importance of this service that Papua New Guinea haven't seen for many years. Much of these health facilities can only be found in urban areas. For those in the rural areas, they are still a long way off.
And we have to be aware of the fact that the whole country, 7.2 million people, we have only 9 ophthalmologists trained for 7.2 million people. The requirements by the standards, international standards, are much more higher. So we will need minimum of 65 more doctors to work in the field of eye health.
For those delivering this service, it is a big challenge. Many people argue that PNG is under-resourced with inadequate expertise to tackle these health problems, such as visionary deficiencies. The Fred Ollos Foundation is now looking into the future. It says they are now looking at bringing these services to the bulk of the population in rural areas, where most of the people have only heard of it but never had the chance to use it.
Welcome back. While it is a new era for Papua New Guinea's medical sector, there are more challenges. First, the facility is the only one in existence in the country. And secondly, they have to be focused on how this service can be made available to the bulk of the population in rural areas. While this is a positive move, many say the PNG health sector is still a long way off in terms of providing effective basic health care to the people.
According to the PNG National Health Care, at least 29% of the total population are visually impaired. This is equivalent to about 146,000 people over the age of 50 years old. At the eye clinic in Medang, statistics estimates suggest that the number of people who came to seek treatment here have increased. It gives a picture about the significance of this service that has been lacking in previous years.
Normally, on average, we see close to 300 to 500 patients in a day, but since the introduction of the new eye building and staff, we are seeing close to more than 800 in a month. Last month, we have seen ending last month, we have seen close to 928 patients. So it is going to be increased day by day. As new structures will be coming in, new staff will be joining in, new doctors will be joining in because of the new teaching program which we are running with the team of UPNG or Divine Word University. More and more input is going to happen. You will see new development coming in.
My name is Joyce Oika. I'm from Kerma. And I'm working with Fred Ollos Foundation, and I'm a Fred Ollos staff. And I've been working with Fred Ollos for 5 years. And I'm in charge of the ward. This is the eye ward. And after operations, patients are kept in the ward. And at the moment, we have new operating theater. Now it's open. And I, as a Fred Ollos staff, I'm very proud of the building, because it will save my people who are blind, like a small child, knife wound, line bend, all this comes in the ward where we look after them under the instructions of qualified doctors. And this is the eye ward. I have 2 patients in the bed to keep them here until they are seen, and then they can go home and come back whenever a doctor wants them to come back.
There are still uncertainties if whether or not these health services will be trickling into the rural areas. Nearly all the eye care programs in Papua New Guinea are established in urban areas, and the services provided are sometimes expensive, making it difficult for the rural population to seek help.
There are many out there who are blind, and the message is not going out to the villages and right in the forest or whatever. The problem is transport, road. We don't have good roads for them to come to. And also, I'm a team leader of awareness.
The Fred Ollos Foundation is one of the very few health services, otherwise the only one in existence in the country. Conservative estimates gathered by the National Health Department shows that over the last 20 years, the government's attention has been centered around delivering basic health services to a mere population of the country. Health experts say that there has to be a paradigm shift in the current health structure so that basic health care is delivered to the bulk of the population with little amount of money spent.
It's not a responsibility of PNG government, it's our responsibility, institutions who are engaged in health education, to work together with partners like Fred Ollos Foundation, the National Department of Health, to focus on training the human resource for the current and the future generations here. So that's today was very, very important occasion. And nobody talks about that. And we should be open, and we should be not afraid to talk about our own problems.
Over the past decade, the National Department of Health and international health organizations such as the UN, OSAID, and the World Health Organization have repeatedly reminded us of the deficiencies within the health sector of the country, and most of that information can be recited from memory.
Entirely is new, and we need more infrastructure which is going to be beneficial for eye operation in this country. So we struggle for this new operation theatre.
In the 2015 national budget, 1.8 billion kina was allocated to the development of basic health care services that includes free health care for all citizens. Health specialists say in order to address Papua New Guinea's health problems, there has to be more focus given to refurbishing the current health facilities rather than building new ones. But unless the government takes this seriously, the National Health Department will continue to spend more money with little or no significant results.
Christmas is around the corner. It is one of the biggest holidays in the world. It is a time when people come together to celebrate, but not all celebrations end on a good note. Even some of the most tragic moments do occur during this period. Car accidents, high alcohol consumption leading to violence, and disharmony in communities are all too common. Like many people around the world, Papua New Guineans love to celebrate, and with Christmas around the corner, the festive fever is on. Now you may not see a lot going on during the day, but this part of Port Moresby comes to light as soon as the sun goes down.
Well, to me personally, Christmas is the feast which reminds us that life is so precious. The motto of this church is a symbol of it, I think, that our motto is a family for all, that there's room for everybody within it. And Christmas is the story, the message of Jesus reaching out and embracing the whole world, that it should be a time of real goodwill. We say it very easily, but too often it doesn't really happen.
Religiously, Christmas is celebrated in remembrance of the birth of Jesus Christ. It is a time when families and friends come together to celebrate. But it is also important to remember to be safe, as during this period, many tragic incidents do occur.
At times we started off with happiness, but to end it, many times there is sorrow, sadness, and at times we become angry because of accidents and incidents happen. So to the viewers out there, we were celebrating this Christmas. I would like to say that do it safely, and if you do come across or face with accident or incident, you call us first. If you are not accessible to road networks within our reach, you can even still call to get advice as to what to do in order to assist the casualty, to transport them safely to a healthcare facility.
Road accidents are common during the holiday season.
Motor vehicle accidents is a daily occurrence in Port Moresby because of the increased population and also many road users these days. So our daily average is around 4 road accidents each day we witness here.
Welcome back. As we know, Christmas is celebrated in remembrance of the birth of Jesus Christ. It is certainly amazing how millions of people recognize and remember the birth of Jesus. And just like baby Jesus, children certainly bring a lot of joy into the family. We took the streets and asked kids on what they know about and how they feel about Christmas. You won't be surprised with their answers, as kids do say the darnest things. The Christmas holidays are here, and with school kids out of school, we went out and asked some of them how they felt about Christmas and Santa Claus. As you listen to their answers, you won't be surprised at all. Kids sure say the darnest things. We start off with Ragamo and his twin brother Terry.
What I like about Christmas is about gifts and having fun.
What do you and your brother do on Christmas?
Play.
Okay, does Terry want to say anything about Christmas?
It's the birth of Jesus and some wonderful things.
What do you guys know about Santa Claus?
It's a guy that delivers presents.
Has he ever delivered any presents to the both of you?
No.
How do you know that?
Our parents deliver present to us.
Okay, can you tell us your name and what do you know about Christmas and what do you like about Christmas?
My boo-boo's grandma's to look after me. My boo-boo's and sissy to look after me. Brian's to look after me. I used to stay inside the house. I used to go and play. I used to come inside again. I used to go up. I used to come with my brother.
Do you know anything about Christmas?
My brother went to Medellin and I ate that Christmas. Sakari present come na plenty something Sakari come na give. Imi ba writing letter na any something na sali galen and ba give you me present. Na meetings I'm in Australia. Workshop blame I'm still not phone. Na I'm sakala plus slade na come no pot mostly. Us lo give present the overall picking na man na marry lo our country.
That you be right you up a letter go to Santa Claus too or what?
Me no been writing. Uncle no me been writing na maybe kissy present.
Me dada. Me dada la. Me 6 like present. Me like la lights la last night. La also give present Santa Claus. Wait na. Time sleep la am vacances. Am vakal na bring a present na bago bukay.
In up your story like Santa Claus?
I'm perfect la mom. And Marine, but people let's talk say Marine. Yeah.
I'm the one country.
I'm a white man that doesn't exist. I'm say all let's talk just alone.
I'm going to Revolution. Miss like Christmas with us. So good flat time. Nah, sometimes I believe in Santa Claus. Sometimes I believe in. But the house me basa exchange present. Sometimes basa kilili kai pasa kai. Na sometimes basa go pasa travel out na go place look your family.
Name esta lang sa like Christmas because we can saksi holiday, naksi present na people.
And that's all for this episode. If you have any comments or stories you would like to share, you can send us an email via the address on your screen or visit us on our Facebook page. For now, have a Merry Christmas and enjoy the rest of your viewing on your #1 station, EMTV.